Okay. So we'd like to welcome everyone. I can't see everyone popping up on my screen like usual, but I would like to welcome everyone to our Building a Culture of Community Engagement speaker series. Really excited to be here this evening with our panelists for our topic, behavioral health equity and the role of community engagement. We are very lucky to have with us Dr. Miriam Komaromy, Dr. Jordana Muroff, Ms. Micaurys Guzman from Casa Esperanza, who will be introducing themselves later in the program. Our goal for this evening is really to learn more about the Graken Center here at Boston University and Boston Medical Center and the initiatives that they're doing to advance behavioral health equity, topic that is critical, particularly right now. Also to learn about novel app-based community interventions to advance health equity for the Latinx community. So we're going to hear from our speakers, who those of you who have been with us before know we usually have some time. We'll hear from our speakers. They'll each introduce themselves. We're going to be starting with Dr. Komaromy. And then we're going to be moving over to what I'll call the Casa Chess team that is going to be Dr. Muroff and Ms. Micaurys Guzman. And then once we've heard from each of the panelists presenters, we'll open it up. I have a few questions I'll get us started with, and then we'll be really moving in to take questions from our audience. So with that, welcome to the speaker series. We're excited to have you here on a very rainy, better than snow evening. And with that, we will get going, and I'll turn it over to Miriam.
Wonderful. Thank you so much, Linda. I appreciate the introduction, and I'm really excited to be here. Let's see. Just trying to share my slides. Is that coming up? Can you see my slides now?
Not yet. Not yet.
Not yet. Okay. What's confusing is I think I'm seeing the slides that you're sharing as well.
Miriam, I don't see any slides on the screen at this time.
Okay, I must have. Let me pull it up. Here we go. Okay.
Perfect. Yeah, perfect view.
Great. So I'm Dr. Miriam Komaromy. I am a professor of medicine at Boston University and medical director of the Graken Center for Addiction at Boston Medical Center. And I'm really excited to have the chance to share with you tonight some work that we've been doing over about the last year and a half. That is really something that's been incredibly energizing and fun, as well as feeling like it's pretty important. So without further ado, I will jump in. We refer to our project as substance use disorder and anti-racism. Its more formal title is Embracing Anti-Racism and Addiction Treatment Research and Policy, Engaging Black People with Lived Experience of Substance Use Disorders. So, you know, it's not really news that Black Americans have worse treatment and outcomes from addiction. I think we're sort of aware of that just from information we see on the news and from a large body of research. A couple of examples include that up on the upper left, you can see, despite similar rates of cannabis use, Black Americans are much more likely to be arrested for possession of cannabis than white people are. On the bottom right, you can see this is a graph showing prescription of the medication buprenorphine, which is the active ingredient in the drug Suboxone that's used to treat opioid addiction. And it's a newer medication that's prescribed in a doctor's office or a medical provider's office, as opposed to a methadone clinic where someone has to go every day to get their medication. And you can see here in the gray bar that it has been prescribed almost exclusively for white patients in the United States and almost not at all for Black patients. So really kind of a remarkable disparity. So as I mentioned, in some way, I've sort of gotten used to these kinds of figures, but I've been surprised to realize that we actually have some significant disparities between Black patients and other populations right here at BMC in terms of treatment of addiction. So here we're looking at, if you look at the total population of patients who come to our Boston Medical Center emergency department with a substance-related crisis, such as an overdose or over-intoxication, remarkably and unfortunately, most of them do not have a follow-up visit for addiction treatment in the subsequent 6 months. And Black patients are substantially less likely to have follow-up treatment than our white patients. So a group of colleagues who were interested in these issues got together and we started talking about why is this happening? And even more to the point, what can we do about it? What can we do to address it and try and make a difference and engage more Black patients in treatment? Because when you think about it, you know, it's really a red flag when someone has a severe enough substance use disorder that they end up in the emergency department. So we pulled together a kind of working group that's been grappling with this and related issues over the last year and a half. And we slowly coalesced into a project team that has been working on this topic. And we're a group of mostly faculty and staff from across Boston University and Boston Medical Center, as well as a few folks from the community. We comprise people who have lived experience of substance use disorder, as well as addiction treatment providers, researchers in the field of addiction, recovery coaches, social workers, administrators, policymakers, et cetera. So there's quite a few of it. This is a subset of the group that meets the most regularly, but there's actually quite a few people who have been involved. And we really coalesced around a particular question, which is how can we make addiction treatment more appealing and effective for Black patients? In other words, what can we do to create a more welcoming addiction treatment environment, to change addiction treatment so it works better for Black people, and to increase the likelihood for a Black person to seek treatment? And finally, how can we work with people who have lived experience in order to answer these questions? So we launched a project to try to answer this related set of questions in search of an answer to what can we do to improve the treatment that we provide to our Black patients here at Boston Medical Center, but also we thought that this would be information that would have general relevance across the country and would potentially help to transform clinical practice and addiction treatment for Black patients everywhere. So we went about gathering information to try to answer this question in two main ways. The first was that we convened 7 focus groups that consisted of Black people in neighborhoods near Boston Medical Center who have lived experience of substance use disorder, either currently or in the past, or have a very close family member who has really struggled with substance use disorder. We also knew that we weren't the first people to ask many of the related questions about this. And so we've done structured research article reviews to try to learn what's out there in the literature and see if it could answer our questions. As we did this, we realized we were gathering a lot of information and we were going to need a lot of help to try to figure out what to make of it all and to translate it into something usable. And so we applied for and received grant funding from Micaurys, the Patient-Centered Outcomes Research Institute. And what they funded was for us to hold a series of day-long conferences where we would bring together experts from Boston, Massachusetts, and some from across the country to grapple with the information that we had learned from the focus groups and the research article reviews and help us turn that into action items. We also, we recruited people with lived experience from the focus groups, primarily, to join what we call the Council of Experts in Patient Experience. So, I have expertise in addiction medicine because I've studied it and been an addiction treatment provider for many years. Others have experience and expertise because they themselves have struggled with substance use disorder. And we wanted to recognize the input and participation of these folks with lived experience, who in another context might be referred to as patients. So we recruited them and invited them to bring expertise to our 4 conferences of experts that we were going to hold, and to just generally participate in our ongoing substance use disorder and anti-racism project, helping to contribute ideas, to shape the way we approach things, to give feedback on our findings, et cetera. And then finally, to form the nidus for a future Graken Patient Advisory Board. So after performing these focus groups and the research article reviews and receiving the grant funding from Micaurys, we convened our first conference of addiction experts. This was about 20 participants who, as I mentioned, came from really diverse backgrounds. They were social workers, physicians, peer coaches, policymakers, researchers, nurses, and each conference we've had a substantial number of people who have lived experience of substance use disorder. And we got these 20 or so people in the room. We spent a whole day together. We held the conferences at Roxbury Community College, which, as many of you probably know, is the only historically Black college in the northeast part of the United States, and is right here nearby, which was lovely. And we spent a whole day with having a facilitated discussion and grappling with the information from the focus groups and the research article reviews. I want to share a few quotes with you from the focus groups before I go on and tell you what we did, what were the outputs of these conferences of addiction experts. So one participant in the focus group said, it's because you have stuff that you have to do every day, like you have to hustle, you have to survive. You can't just leave and go on vacation to get clean. And then even if you went there, you still have to come back and you still have to do what you have to do. A lot of people have to sell drugs or do whatever. They're in a gang or whatever. Know what I mean? So how are you going to get clean and then come back and have to do the same stuff to survive? Another participant said, they trick you into talking to them, like, you can talk to me. And as soon as you tell them you got an issue, they send your ass away. Now it's like, damn, I know not to trust you guys. We need to have integrated healthcare that includes men of color talking about mental health, because you can get traumatized on a daily basis as a male of color, just in your own community. You know what I mean? And then the last quote that I'm going to share, a lot of Black younger sisters, the first thing that they throw up in their face is, we're going to take your children. So with the drug treatment thing, they're more inclined to stay away from that because they don't want their children taken away, even though a lot of times it's just a threat, but we're dealing with Caucasians too. So it's hard for a young Black sister to accept help. Their children, they're really close. That's one thing they do. Black women and children, they have a really tight bond with their kids. The first time you mention something about taking their kids away from them, they go to pieces. I picked out these quotes just to give you a flavor for some of the things that we heard. Needless to say, it was an incredibly powerful experience to hear firsthand from so many people about their experiences with addiction and with treatment. So, as I mentioned, we held 4 conferences of experts. There was some overlap in the people who participated in the different conferences, but there were new people folded into each conference and some who didn't participate a second time. We roughly organized them around factors related to the patient experience, treatment provider factors, system factors, and trauma as kind of the frame of what we talked about in each individual conference. And what we got out of these conferences is we weren't aiming to just have a theoretical discussion. we actually wanted to produce actionable information from the conferences. And so we were focused in the second half of each day on developing action items, items that came out of the focus groups and the research and article review, and that the group felt could help to improve addiction treatment for Black people. We also found things that we thought were really important to know, that the answer was not clear. And so we've developed lists of key unanswered questions coming out of the conferences of addiction experts. I want to just give a couple of examples of action items and key unanswered questions. And these are just samples. There are many, many action items and questions that we came up with. Action item examples included: empower Black patients to evaluate the treatment that they're receiving and use their feedback to improve care. Develop a process for addiction treatment providers to examine their own thoughts, feelings, and behaviors and understand how these may contribute to creating a hostile environment for Black patients. Redesign addiction rehabilitation programs to be based on positive reinforcement rather than mimicking a carceral system of punishment. And then a couple of examples of key unanswered questions. What practical measures can help Black patients to feel more empowered in treatment relationships and able to shape their treatment? And are outcomes of addiction treatment better for Black patients if they're treated in organizations that are staffed primarily or exclusively by Black people? So we are still in the process of, we're about to have our final one of the 4 conferences next week. And then we'll jump into collating and trimming and interpreting all of the action items and getting them ready to share more broadly. These are just a sample of a few of the products that we are aiming to create out of this work. Developing action items, the future research agenda, writing a variety of academic papers and white papers with a lot of details, presenting in the community and at academic meetings, developing a toolkit for others who want to implement action items in their clinical setting, etc. So that is the end of the slides and what I wanted to share. Thank you so much for your attention.
Thank you so much, Dr. Komaromy. We really wonderful presentation. We're gonna next hear from Dr. Muroff and Ms. Guzman, and then we'll start with our Q&A portion.
All right, Micaurys, you want to jump in?
Sure. Hi, thank you for the invitation. And so today we're going to be presenting on the Latinx community engagement in technology to enhance behavioral health equity, Casa Chess Relapse Prevention app. And that is in partnership with Casa Esperanza, which I am representing today, and Casa Chess, and the School of Social Work with Jordana. So just a little bit about myself. My name is Micaurys Guzman, as mentioned before. I have been working at Casa Esperanza for the last 8 years, and that is supporting the Latinx community within the Roxbury, Boston area. And for today, we are going to be presenting on the Casa Chess app, which is a project that we have had a few times, but more specifically this time around with funds by the Rise Foundation. And before we did had a project which was bigger with SAMHSA CSAT funding. So just to get started, Jordana, do you want to present yourself before we jump into our presentation?
Sure. Hi, everyone. Thanks so much for the opportunity to be here. My name is Jordana Muroff. I'm an associate professor at the Boston University School of Social Work, practitioner, researcher, and chair of the clinical practice department as well. And feel very fortunate to be a partner with CASA for, gosh, about 15 years or so. So I'm really glad to be here and co-present with you, Micaurys. Thank you.
Thank you. And so just about a little bit about Casa Esperanza. Casa Esperanza has been around since 1984, and it was rooted in providing services to the Latinx community in a culturally and bilingual manner, which was highly needed back then when the first Casa Esperanza men's program opened up. It was mainly alcohol use disorder, and it was rooted in the 12-step program. Our mission is to empower individuals and family to recover from addiction, trauma, mental illness, and other chronic medical conditions, to overcome homelessness, and to achieve health and wellness through comprehensive integrated care. Our vision of the future is that all affected by addiction and mental illnesses are empowered to lead healthy and purposes life. And so if we go to next slide. This is just a little bit of who Casa Esperanza has been serving. And this is coming from SAMHSA data, and that is our different federal grants collect data into people that are enrolled, into patients that are enrolled into the multiple grants. And this is more like around the demographic and how the clients that are coming to see us identify. And I will use clients and patients intervally to refer to our members. So 92% of our populations identify as Latinx. 40% only speak Spanish, and that is this question in particular. It's more around like, do you know any English? And if they're like, even if they can read a little bit or if they can understand, they would say yes, and so they would not necessarily be qualified under these 40%. So those that have that prefer or that will only identify as a Spanish speaking might be higher, but the way that the questionnaire it's being, or the question is being asked, it leads to this, but it's higher for sure. 40% prefer services in Spanish only. 98% have co-occurring disorder, that is substance use disorder and mental illnesses. 95% are housing insecure, and most of them are chronically homeless at the time of coming to our different programs. 78% were formerly incarcerated, so supporting patients to reintegrate into the community. And 88% are unemployed or unable for whatever reason to seek employment. So those just a little bit of like, who do we see? And this is not data after COVID. This is pre-COVID. So these numbers have been extended. And I know from day-to-day experience, we have an increase in people seeking services for mental health only, which was different for Casa Esperanza, as we were rooted in substance use treatment. So we are well known as a substance use treatment facility, residential program, and so people will come to us just because of that. And why, when this data was collected, 98%, which is very high, had co-occurring disorder at the time of coming in. Our intake have increased post-COVID, and it is just kind of like dealing with the aftermath, but also the needs of services within the Latinx community. So next slide. And so Casa Esperanza see treatment as a holistic manner. And with that is we are kind of closing the gap of services that are provided for Latino by Latinos in a multicultural and bilingual manner. And so while the program, or Casa Esperanza, originally opened as a residential program for men, today we have our original residential program for men. We have Latinas y Niños, which is residential program for women. Latinas y Niños, we welcome women in recovery with their children. There is a age restriction there, but we also welcome women into treatment with the hope of reuniting families while they're still receiving services at Latinas y Niños Center. We also have supportive housing programs, which is we have, in partnership with local housing authority, we have some units for housing where we are providing still support and people are kind of re-engaging into the community, but yet they have that additional services, that additional support if they are needed, and they are also subsidized for the most. We have Familias Unidas outpatient program, which is the outpatient at Casa Esperanza. We will go in detail into the services under the outpatient program, but also, and in partnership with Boston Healthcare for the Homeless, we are able to provide medical care within the outpatient. And again, is kind of closing the gap and linking and providing all the services in one location. Someone were to come to our building and see how little it is, but then when you see the intent and the variety of services that we have within the same outpatient building, it's amazing. And due to COVID, we extended our services to telehealth, and that has allowed us to continue supporting patients coming to us, even if they're not within the common Boston area. So we are serving people that are residing in Lynn, they are residing in Lawrence, which is again high Latinos or like a community of Latinos in those areas, and not necessarily as many services available. So telehealth allow us to continue providing services beyond the physical location. And then we also have our clinical stabilization services, or Conexiones, and that is the only program that is now within our main campus located in Roxbury. CSS Conexiones is actually located in Tewksbury in the hospital. And the idea is a step down from detox, and before they're ready to engage in outpatient treatment or even in residential treatment, that they have stabilization services, either medically or with medication at CSS or Conexiones before they are engaged in the other services. And then the next slide. And then, so outpatient, as mentioned, we have regular outpatient services, group, individual therapy, comprehensive assessment. We also foster our SOAP or Instructor Outpatient Addiction Program, and that is in Spanish only. While this service is provided in other organizations, at Casa Esperanza, we are the second within Massachusetts providing this in Spanish only. We have Seek and Safety, we have Grief, Trauma and Recovery. So within the clinical component, we have some regular services, but we also have enhanced services such as SOAP, Seek and Safety, and integrated dual diagnosis treatment. Within the medical and in partnership with Boston Healthcare for the Homeless, we have primary care, medication-assisted treatment, psychiatry services, and HIV and STDs, prevention, testing, counseling, and screening. And then within the outpatient, we also have recovery support services, and that is recovery coach, case management, anger management, navigation, relapse prevention, transportation. And within the relapse prevention program, and now back to like the original novel app, which is the Casa Chess app, within the services, so that it's in a way to extend services beyond our wall. And even before telehealth services was something available to us, we were connecting with patients through the Casa Chess app. So, Jordana.
Thank you so much, Micaurys. That was great. Really appreciate that. So I, when I got invited to do this along with Micaurys, we were talking about what's a community engagement expert. And I actually don't identify as a community engagement expert, even though I've been collaborating with CASA and other community partners for a while. I guess I think of myself as a community engagement learner, kind of a lifelong learning kind of process as well. So I'm excited to kind of provide some additional kind of detail, if you will, related to this particular collaboration around Casa Chess app that, as Micaurys was saying, has actually been going on for about a decade now, in terms of the development of the app over time and its growth as well. Next slide, please. You can see, as Micaurys had mentioned, who are our collaborators together, and just a shout out to a few folks on both on the call and who are part of the team, both present in the past. Vicky Lee as a School of Public Health student, Dan Doe is a social work doc student, Luz Lopez and Deborah Chassler, who was part of this for many years as well. And then a number of folks at CASA, Micaurys and others, including CASA Chess, of course, clients and a previous CAB that was it's in reorganization now, but was very active as well. And then through the Center for Health Enhancement Systems studies as well, Dave Gustafson and Dave Gustafson, junior and senior as well. So next slide, please. So in terms of app, as many of you know, the Latinx communities are disproportionately, of course, affected by risk factors for substance use disorders such as homelessness, poverty, lack of insurance coverage, violence in the community, and so forth as well. And these increased risk factors are driven by structural challenges, right, and systemic racism. And we also kind of conceptualize substance use disorder as potentially a response to racism and other structural factors as well. And so, as many of you are familiar as well, the consequences are dire for the Latinx communities, with opioid-related overdose deaths being especially high, especially in Massachusetts. Mass has had the highest opioid-related overdose death rates for Hispanics. And so for a long time and persistently, we've also known that the Latinx community has been reliant on mobile technology for internet access and have been less likely to have computer access at home with broadband services and so forth. And that mobile health interventions were well received among Latinx persons for quite a while as well. So to address these gaps in health inequities, the partnership was established to provide an access to a culturally and linguistically relevant behavioral health and recovery support services, being CASA Chess here, and the initial app platform, so the pic on the left, excuse me, was more Android based for the first bunch of years. And then in an effort to make CASA Chess more accessible and user-friendly, we more recently developed and launched a new CASA Chess app that's a cross-platform version for the iPhone and the Android that was more recently funded by the RISE Foundation, as was mentioned. Next slide, please. So just to give a little bit of snapshot, so the CASA Chess app is based in self-determination theory, right? So there's components around autonomy, relatedness, and competence. So there's features like recovery information. It is both in audio and also in text form as well. The panic button, different motivational strategies. But what we really notice is across the different projects utilizing CASA Chess, the community most commonly use features that are related to or are connected to relating to others in the community. So discussion board and messaging with case manager, with other peers in recovery as well as photos, and then weekly surveys and medication reminders as well. So those have kind of been our top features that have been often utilized. Participants again interact with others who are receiving substance use support through CASA and case managers and other mental health providers at times as well. The other features have been kind of things like daily affirmations, podcasts, and we've also had folks record their own recovery stories too, of their lived experience to be able to listen to and share with others as well. Our studies have shown that CASA Chess is feasible to kind of use. It's been acceptable, and across the different studies, a range about 70 to 75% of clients use the app for 4 or more months to help with their relapse prevention. And at first I thought, oh, that's not a lot of time. But then when I think about folks in terms of in recovery and thinking about technology and how that kind of comes and goes, 4 or more months in a lot of ways is a substantial period of time. And also every day is staying close to one's community during recovery could potentially save lives as well. I'm going to put in the chat a couple of articles for those who are kind of interested in kind of more more info on the app and the usage and so forth as well. And so similar to the first presentation in terms of thinking about, what is kind of some of the feedback. So just some quick quotes that clients have shared. Some folks have said, thoughts of the day make me feel motivated and allowed me to ignore old thoughts. Every time a message comes in, I answer it, and it gives me a reason not to relapse. I listen to my recovery story over and over because it makes me feel good. And of course, there's critiques as well. I don't like the surveys. They're annoying is another quote as well, which is honest and true. So in terms of, the app is really centered social support. It's been, which is of course essential in coping with stigma regarding substance use disorders and mental health disorders in the Latinx community. It's also a space to raise community strengths and address health equity specifically. So the app, we've utilized it as a source of support from the standpoint of providing information on client rights, relevant information related to COVID during the time, addressing issues around vaccine equity, information around overdose prevention, Narcan use, and so forth as well, to support folks as well. Now, what was interesting, while most people were like on the app and didn't necessarily always see each other during periods of time, there have been cohorts that wanted to kind of do what we call kind of meetups. And so they did kind of come together. And in one of the meetups a few years ago, clients were talking about the use of photos and their desire to kind of share photos and speak about their experiences through photos as well. And so that kind of led into, next slide. Thank you. The use of photo voice. So this is one example of our past photo voice, one of the past photo voice projects. And that was also in collaboration with some others on the call too, Linda Sprague Martinez and Deborah Chesler and several others and at BU and at CASA. The CASA clients utilized, because they had the phones through the grants, they used those as kind of the cameras to take the photos and took photos of how different ecosystems, social groups, communities, institutions, policies have influence on their recovery from substance use. I'm also going to put in the chat another paper for those if you want to delve more, but just to kind of give some snapshots here. As many of you know, photo voice is a qualitative method rooted in empowerment education and feminist theory for participants to record and reflect on community strengths and concerns to promote critical dialogue and knowledge about important community issues through small groups and discussions around photos and to reach policymakers. So, of course, those most impacted by social problems often don't have input into that decision making. And so these are some photos, and of course, these are translated from Spanish from one cohort. So the top left photo was plants that were given by a participant by her son, and what themes kind of came up for the participants included life, health, motivation, hope, faith, responsibility, and humility. And the plants were like company for the participant and also reflected a responsibility of taking care not only of the plant, but also taking care of oneself and oneself as part of recovery as well. The photo of the church in the upper right, participants spoke about religion and spirituality associated with feelings of love, hope, and inner peace, as well as unity in the recovery process. For the photo at the bottom left of the bedroom, participants spoke about experiences of unstable housing and houselessness, homelessness, and how having a private space, home space, was crucial to their recovery, and it reflected security, motivation, strength, progress, community, quality of life, responsibility, order, and discipline. And then the tunnel on the bottom right was associated with darkness, fear, obstacles, light at the end, new changes, clarity, hope, and fight and struggle. And these words reflect how hope is a consistent theme throughout the recovery journal, that it's complex and filled with challenging feelings during recovery, participants noted not only sleeping in the tunnel and using drugs in the tunnel, but also it being the light at the end of the tunnel as well. The participants named their what kind of became like a poster, if you will, called Nuestra Recuperación, or our recovery in English, and wished for it to be a source of hope to others in recovery. That was really, really important, that to the cohorts in terms of speaking to their collective orientation and cultural values as well. It also highlights not only hope and challenges and power structures that also can inform change at institution and agency levels. So we have been really interested in, as part of the current RISE project as well, talking about technology as not only as a medium, but photo voice as a method to center lived experience, share individual and community strengths, and also facilitate a collective response, and thinking about incorporating issues explicitly around equity, and also in terms of anti-racism as well. So the experiences and voices of the Latinx community are crucial to drive discussions that advance policy. Again, in the areas of housing, stability, and access, and also enhance providers' understanding of Spanish speakers with substance use disorders recovery, and also inform culturally and linguistically appropriate services moving forward. And this cohort that first started the photo voice, now there's been multiple cohorts as a result, because others kind of heard about it and we're excited to do it as well. And so there's been real sustained interest and ongoing use of photo voice, and also discussion and hopes around some more social action around that as well. Thank you so much.
Great. So we could have a round of applause for our speakers. Wonderful presentation. So many questions. Really just wonderful, wonderful work all around. I'm wondering, I'll just start us out with a couple questions, and then I'll turn it over to questions from the audience. One of the questions I had in thinking about both of the presentations were really centered around the community and engaging community. And I wonder if you can just talk about, as researcher and as a practitioner, Micaurys and Jordana, you're also researcher practitioner, you kind of bridge. Why is community engagement so important in the work, and how specifically as researchers has community engagement advanced your research? And then as practitioners, how has research advanced your practice? So I wonder if you could share a little on both sides.
Micaurys, do you want to go, or you want me to jump in first?
Either or. So I think I can go. So why community engagement is so important? I think it's reading the community, knowing what is needed, what what exactly the community is looking for, but also how we are going to be translating that into serving the community itself, right? Because sometimes we can see the need as a whole and not necessarily understanding it from standpoint. And I think Miriam mentioned this, which is, supporting the African-American community by African-American people, right? Like who understand the community. And it's like putting the face of the people. It's like coming and feeling welcome because I will be understood, and being able to relate that as a service provider, but also, and not necessarily that research is my area, but in working at Casa Esperanza for the past 8 years, how we have been using research, or how we have been using the data that we are collecting through these different grants, it's also to close gaps into services, right? And so understanding the community that is coming to us, but also how, what do we do once we understand the community, right? Like for instance, Casa Esperanza started as a residential program, and today we have this range of services. And it's not because we wanted to open this, but it's more, hey, we are in need of this, right? And it's like for CSS, which is our newest program, we were in need of a support in between detox and additional services. Why? Because our patients were going into detox treatment and not necessarily have the program being available in a language, in a culture that they don't understand. And what they feel is that they stay there, they were managed medically, but nothing else. And it was hard not finding an additional program within the community that will be able to kind of bridge or support that next step before they feel like, being in detox for these many days, I feel like I have done nothing. Yes, my symptoms were controlled, but that's what's next, right? And so CSS was very important because we were having people coming directly from detox into the residential program, and that was harsh because it was like they were still not stable to be able to engage in that level of care, right? And now what we continue to do, like there has been different papers and articles that are coming out of these different researchers, these different data that we are collecting into what has been working for our community. So all the people that are trying to do similar work see like, okay, this is what's happening in Boston for the Latinx community, and this is how it's relevant to the community that they are supporting, but how can we translate that into the community that we are supporting, right? And it's specific for the Latinx, but I think that the model of understanding it can be translated into other communities.
Great, thank you so much. Miriam or Jordana, do you want to chime in?
Sure, I could jump in a little bit in terms of, I mean, I think the as Micaurys is saying, it's like what's the it needs to be community driven priorities. So from my standpoint, as a researcher and as a practitioner, that drives the research questions in a lot of ways, and also leveraging certain resources in order to be able to pursue those questions very specifically as well. And so the long-term relationship in terms of the collaboration helps kind of have those honest conversations in terms of collaboration of like where those priorities are, what's most important, and kind of working through in terms of those collaborations how to kind of organize those goals and work together to kind of be able to achieve them. So from the standpoint of what might be the priorities of the funder and what kind of data needs to be collected for that, but what kind of is also meaningful for the community in terms of as Micaurys so well stated, like in terms of informing programs and that which the community really wants to focus on, and also managing the institution of the university kind of simultaneously as well, so that and also thinking about growth over time. So I think about, CASA over the last 10, 15 years has just grown tremendously, which has been so exciting in terms of the collaborations and kind of thinking about what are the priorities over time, and how does as Micaurys, like you said, like how does the data kind of help shape some of that, but also how does the how to kind of think about what are up and coming questions that are most meaningful kind of moving forward as well.
Thank you so much.
Yeah, I know we want to get to audience members' questions, but I'll just say, yeah, it's been a really profound experience for me to engage in the kind of ongoing give and take that we've had with community members. I've worked with patients who have substance use disorders, including many, many Black patients over many years. And yet the kind of discussion and interchange we've been able to have working together on a research project is just incredible. I've learned so much that I never would have learned if I had just stuck with my assumptions and framework and sort of my academic and clinical approach. So it's been a fantastic experience for me, very humbling. And it's also changed my clinical practice. When I see my Black patients, I feel like I hear sort of a background of the types of experiences that have been shared during the work that we've done with the community. And it just really gives a greater richness to my understanding of their experience.
No, definitely important point. And it's when you change the power dynamic within your relationship, because you go from patient provider, which in our country has, in many countries, has a natural, you know, like a power dynamic, right? So there's when you become partners in research and the nature of your relationship change, its power flows in a different way. And so it can really begin to shift how you learn and what you learn and what you share. So really, really great example. I'll turn it over to the audience now. I could talk for days, but occupational hazard. But I want to hear from folks in the audience, reactions to what you heard, questions about what you heard. I saw Vicky Lee, you just came off of mute for a second. I'm really eagle eye like that, so be careful. I didn't know if you had a question or a reflection. Didn't mean to scare you, sorry. I know Vicky, so I'm not just giving her a hard time. Rebecca has her hand up, so we'll fly over to Rebecca. She saved you, Vicky.
Thank you all for these great presentations. Just amazing work that you're doing, and great examples of community engaged research, whether you see yourself as community engaged researchers or not. My question to the researchers, Miriam and Jordana, is what advice might you give to junior faculty who are very interested in starting a program of community engaged research? We so often hear from junior faculty, you know, where do I start? I'm very passionate about this topic, but I don't have community partners. And then I'd like to turn it over to Ms. Guzman and ask the question of what do you look for when researchers approach you to partner? So we can maybe start with the researchers first.
Do you like to go ahead, Jordana?
Sure, either way. So I think in terms of advice, it's like any relationship. You need to show up, you need to listen, you need to kind of connect, and again listen in terms of what are the parties showing up. When I first moved to Boston, showing up at a lot of community meetings and listening, getting to know people, and connecting over time in terms of not trying to establish a transactional relationship as much as kind of a real caring relationship. I want to know about, what's going on here. I want to know what the priorities are, and that might match what my preconceived notions are, or where I was hoping to go in terms of research or not. But that's kind of not the point. It's really investing in that relationship in the long term, which takes time, takes patience. It takes I like what Miriam said in terms of just humility and humbleness in terms of that process too. And that, I explicitly said I'm not an expert in it, because from the standpoint of in a relationship, that power dynamic has to be from the standpoint of, collaborative and be a learner in that process. So I think taking that kind of learner role, and following the lead also from community partners is a crucial aspect. I really can't emphasize that enough. Community agencies, I think, are under so much pressure, so many things are kind of going on and have their own rhythm and so forth as well, which doesn't always fit the how can I say, the pressures of the academy in terms of research grant deadlines and other kind of things that are kind of going on. And so the patience in that kind of dance is just crucial in terms of timing for things and connection over time as well. So I think that's a big part. I think for also connecting with teams, so like I first connected with CASA through some others initially, and kind of attended some things at CASA with some others who were already in partnership with CASA. And so that kind of, friends introduce friends, so to speak. And so that was a really important piece too, is kind of getting to know others who collaborate in developing those kind of team efforts as well, was a really important piece too. And I think being transparent about, the various pressures at times, and being kind of forthright about that is also important too, in terms of just having honest conversations at times in terms of what, like in any relationship, what's working, what's not working, and how to kind of continue that dance over time as well.
Yeah, and I would say for advice for junior researchers is jump in, don't wait as long as I did to really dive into real nitty-gritty engagement with the community. And a lot of traditional research projects have opportunities for then extending them, sort of building on them to form engagement with community members that can then inform subsequent work. So for instance, we recruited kind of our core team of community members from the focus groups. And they've then become partners on the subsequent parts of the research. So that I think you don't necessarily have to have a separate pot of money that's, oh, I'm going to recruit community members. They can kind of be, this grant opens up the opportunity, or this project opens up the opportunity to work with community members, and then I can extend that.
Yeah, and I think something and it was mentioned a couple of times, which is this collaboration, this partnership, and that's exactly like what I would say looking into researchers, right? And just looking like at the word research, it can have this big title and it can be intimidating, right? And it can put someone or direct care staff in this position of like it's far. And when I have engaged or supported or been supported by researchers, it has been a partnership. It has been a community, is coming to us as the worker, right? Like the people understanding and gathering this data and engaging with the community with a sense of what does it mean, how did it feel when you were asking these very intrusive questions, like what support can I provide? It's even looking at the data and kind of questioning, like, what is the story behind the data? Tell me about this person, and it's like, yes, we keep confidentiality, and it's like not understanding. I remember like having questions, why are clients stating that they have better support system when they are first in recovery, and then 6 months later, everybody seems to be detached from their support system? What does that mean? It doesn't make sense from the data standpoint, because you would think that will grow. And it's like, no, support system at the beginning of recovery, it's like the people that they might be using with or were using with, and now that it's detached, right? And now it's like, I'm alone, and I'm rebuilding my support system. And so it's like, from the researchers, what is it that we are looking for? It's people that come into us with this idea of like, I wanted to understand what's going on in the day-to-day, right? Like I wanted to understand the data that you are collecting, and like, what is the intention for the community? At the end of the day, it's the community. Like, what is the intention of the researchers with the community? Is it, and again, I have mentioned before, is it writing articles around like supporting our community that will better other or juniors, researchers or juniors providers into understanding a little more of the community that we are serving. And I think that's that is what I'm looking for, right? Like talking from the standpoint of a passionate person in the day-to-day service delivery. That's what I'm looking for. I'm seeing that same passion coming through that research and not necessarily detached from the day-to-day work.
Thank you so much. Great points. One thing I really appreciate you were mentioned and you threw out there is that community organizations are collecting data, right? And I think sometimes researchers forget that we're not the only ones who collect data, and that sometimes we find some of the best data is available through community partners. So I think that's also really important on the day-to-day. I'm going to jump in. Cynthia has a great question here. and congratulates all the great work being done, asks what efforts are underway to ensure the leaders of research efforts look like the represented participants. So what are some efforts that are underway to diversify the research pipeline and really thinking about how are we thinking about building teams that reflect the community? And that can include, I know, Miriam, you mentioned community members on the team. The same, Jordan, I know you've done some work, community members on the team. What does that look like in terms of efforts that you've seen underway?
Yeah, I can make a few remarks on that. You know, as I'm half American born Caucasian and half Peruvian, actually, but I'm not Black, and I will never have the perspective of being a Black person, even though I'm of sort of mixed ancestry and have a little bit of a window into, you know, to the experience of people who didn't grow up with an experience of power in this country. And I've been tried to be really thoughtful about ways of not centering myself in this research. Our collaborative group of researchers is made up primarily of people of color and more than half Black. And our focus groups were facilitated by a person with lived experience and another person, both of whom are Black. And the research group, the active people who are actually doing the research are primarily Black people. And as you mentioned, Linda, we're weaving in more and more of the voices of the community, and we're doing things like before each of the conference meetings, we have a preparatory meeting with the community members to kind of help them feel comfortable with the material we're going to be discussing, not surprise them, explain terms that we think might be confusing that might come up in the conversations, so that they are more and more comfortable voicing their ideas and feelings during the meeting and shaping where the conversation's going and the project is going. We also have been fortunate to attract some graduate students to work on the project, and a Black female graduate student is going to do a research year with us next year, a postdoc. So really excited to sort of support her in writing some grant proposals for next steps of the project. And I really see myself sort of handing off the project to several of our team members who are Black to sort of give them voice and the opportunity to move in the direction of research leadership.
That's great. Thank you. Jordan, anything you want to chime in?
Yeah, I think you know, there's some similarities in terms of thinking about you know, prioritizing the constitution of the teams, at least on the university piece of it, in terms of involving students of color. You know, in our case with Casa Chess, everything is in Spanish. So all the interactions, all the interviews, the app, everything is in Spanish. So we're always trying to connect with students at all levels who are Spanish speaking, and getting kind of the word out in terms of what the collaboration is like, to then engage more students as well. And also, like, it kind of connects also to the question of kind of junior faculty, because from the standpoint of thinking about the pipeline over time. So there's an undergraduate who's really interested and connected and passionate, and so they become involved and connected, and that maybe want to enter, think about doctoral work and so forth. And so it kind of becomes a trajectory over time too. Also, a number of the staff through CASA, I mean, most of all the staff are bilingual, bicultural, Latinx. And so thinking about also what are educational opportunities as well, in terms of, and thinking about leadership, collaborating, there's, we all know in terms of the academic world, capitalism, publications and so forth. So kind of making sure that not only is there a pipeline, but that capital is kind of developed along the way too, in terms of collaborations on papers and presentations and all kinds of things as well, as another component that is not of course, it's most important in terms of the value, in terms of the contributions, and we know that those products also serve in terms of moving forward as well. And really, I think or I hope, as a white researcher, kind of, as Miriam was saying, kind of taking a step back and kind of really listening to the team members and really centering the leadership in terms of the team, and not leading with kind of an expert type of way in that process is crucial as well, in terms of thinking about developing leaders and building that capacity and confidence over time as well.
And I'll just add one point to this really great conversation, is that as a school, one thing is really also thinking about who are our faculty and who are we hiring. And so I can say for our school, in the past 2 years, we've hired 5 new faculty, and 4 of whom are people of color, Black or Latinx. And so I think it's really important that we think about workforce, and CTSI also has pipeline programs to really support researchers as well. And so I think that we need to really focus more on that in terms of changing the face of academia. So really great question, Cynthia. Hopefully we got it answered on our end, but we still have a lot of work to do. We're not like trying to make like it's all perfect, but we are working towards it. So any other questions? I know it's 6:09. We're usually wrapping up next few moments. Any other questions from the audience? It's a quiet group this evening. They're awed by the amazing presentations we had. Oh, I see Jennifer coming on screen. Do you have a question, Jennifer?
I didn't have a question. I just
Oh.
wanted to say thank you for such a great presentation. Like, I think it's always so amazing to hear about the thoughtful work that's happening. And I think just so many of the practices that we're seeing, people are being, groups are being a lot more intentional. And so just having groups like yourselves presenting on the work that you're doing just gives me hope that like there are people really truly dedicated to doing this work and doing it well. And so I just wanted to say how much I appreciated this conversation.
Yeah, no, it's really wonderful. And I'm hoping that I'm looking forward to, I'll say, reading the process too, because a lot of times we publish the outcomes, but here your process is an important outcome for others to be able to replicate and learn from. So I'm always saying, publish the process. There are places for that. So great. If there are no other questions, I will encourage everyone to please fill out our speaker series evaluation, give us some feedback. We can only get better with your feedback. I will also let you know that we have next month our speaker series panelists coming in as well. My gosh, I just lost the topic. It'll come to me in a second. Adima, I forgot what we were talking about next month. Measuring,
Yep.
I think it's measuring community engagement next month, if I'm
That's-
remembering.
It's in March. There's a little schedule change. Measuring impact of CE is in March, but next month we have members from our health equity and research community advisory board joining us, which will be a really rich discussion as well. And the link to register for that is in the chat.
Thank you. Sorry, I got all, distracted. So wonderful. So it'll be great to hear from the advisory board. They have been doing some amazing work supporting researchers and thinking about their protocols and ways to advance health equity through their protocols. And so please join us next month. Bring a friend. We look forward to seeing you. Now you're going to start getting all of our emails if you're here. So great. Great. So we'll